Today I will be talking to you about defibrillation and the basic safety operation of the machine. Rapid defibrillation can be life-saving. Defibrillation is a non-synchronized random administration of shock during a cardiac cycle. It is the treatment for immediately life-threatening arrhythmias, wherein the patient does not have a pulse. The shockable rhythm are the following: ventricular tachycardia and ventricular fibrillation. And for cardioversion is a synchronized administration of shock during R waves and QRS complex of a cardiac cycle. It is a process that aims to convert arrhythmias back to sinus rhythm. The indication for electrical cardioversion are the following. One is supraventricular tachycardia, or the so-called SVT. Next is atrial fibrillation. The other one is atrial flutter. Then ventricular tachycardia with pulse. And any patient with reentrant tachycardia with narrow or wide QRS complex with ventricular rate greater than 150 beats per minute, and who is unstable. Example is one who is having ischemic chest pain. There are two kinds of defibrillator: an automated external defibrillator. It is usually called an AED, and the manual Cardiovert or defibrillator machine. AED machine recognize shockable rhythms and set current levels automatically. Some AED also defibrillate automatically, but others prompt you to defibrillate. AEDs have electrode pads. Attached to the pads incorporated gel. And with a manual Cardiovert or defibrillator, the user must recognize shockable rhythms, set current levels, and decide when to defibrillate. These machines usually have paddles that are held against the chest to monitor rhythms and deliver a shock. Sometimes the paddles can be replaced by adhesive electrode pads for both machines. The pads or paddles are placed in the same location. Place the anterior pad just to the right of the sternum, below the clavicle, at the second or third intercostal space. Place the lateral part paddle below the left nipple, just medial to the anterior axillary, lying in the 5th to 6th intercostal space. If using a manual defibrillator with paddles, you must place conducting materials between the paddles. You need to place a gel to avoid skin burns. It is either a conducting gel sheet or liquid gel that you place on the paddles. With an AED, turn it on and follow the screen prompts. Be sure that no one is touching the patient when it's time to deliver a shock. With the manual defibrillator, you must first verify the rhythm on the monitor showing pulseless ventricular tachycardia or ventricular fibrillation. Continue CPR while you select the appropriate current level. For basic machine, use the manufacturer's recommended energy level. Biphasic machine delivers current into two directions. For monophasic machine, the current flows are in one direction, so use 360 joules. Then press charge button. When machine is charged, loudly state clear. I am clear. You are clear. Everyone clear. All clear. And look around you to ensure that no one is touching the patient or the patient's bed. Make sure the oxygen source is removed from the patient. If you're using pads, deliver the shock by pressing the button on the machine. If you are If you are using paddles, press down paddles at the same time. Press down firmly on the chest wall, and push buttons on both monitor if the rhythm remains ventricular fibrillation or pulseless ventricular tachycardia. And do a 2-minute CPR and shock again and increase the energy level. Okay, let's talk more about the AED. AED is a automated external defibrillator. It is intended for use only on patients in cardiac arrest who are unconscious, not breathing normally, no pulse or signs of any circulation, and at least 8 years old. We're going to look at how AED mode operates using physio-controlled default setting, but be aware that the LifePack 20E in front of me can be set up differently based on your organization's medical direction. Make sure you are familiar with how your 20E is set up for your protocols. So let's begin. You have an unresponsive patient. Verified patient is if it's not breathing normally and has no pulse or other signs of circulation. Turn on the defibrillator, bare the chest, prep the skin if necessary, place the electrodes in anterior lateral position. Make sure the electrodes do not touch each other, leads, wires, and Acg electrodes. Also, the dressing or medication patches. Place electrodes away from implanted devices if possible. Be sure the entire electrode surface adheres to the skin. Use fresh electrodes if you have to reapply them. Push Analyze. This message appears on the monitor. Push the Analyze button. No one should move the patient during analysis. The CPR, and then stop CPR and make sure everyone is clear of the patient, and then push the analysis button. Analyzing now. Stand clear. Shock advice. You can see this in the monitor. Stand clear, push to shock. Before you push the shock button, this one, make sure that you have to look around you to make sure everyone is clear of the patient and clear of anything in contact. Make sure concentrated sources of oxygen are well away from the patient's chest. If it's not safe to push the shock button, you could press the speed dial here to cancel the charge. If you don't push the shock button within 60 seconds, the defibrillator will automatically cancel the charge. So you will see the message if you do proceed to shock. Analyzing now. Stand clear. Shock advice. Stand clear. Okay, all clear. Now push the shock button. Yeah. The defibrillator delivers the shock. Prompts you to perform CPR. To start CPR, you can see this in your monitor. A CPR time will count down. The metronome helps you to time compression and ventilation. Remember to do compression hard and fast according to the current recommendation at the end of the CPR time. The AED prompts for another analysis. Push Analyze button. Continue to follow screen messages and voice prompts until the code. Until the code team will arrive. Okay, let's go back to the beginning. The code team arrives. You've determined the patient is in cardiac arrest. You follow screen prompts and push and analyze. Analyzing now. Stand clear. If AED does not find a shuffle rhythm, you get this message, no shock advice. And then it goes straight into CPR time. It starts CPR. At the end of a CPR time, push, analyze, and it tells you to push, analyze. Okay, let's talk about this LifePack machine, and I will show you how this machine works. LifePack device is able to defibrillate, cardiovert, pace, and state of emergency. It is important that you are able to confidently connect and run this device for your decompensated patient. The machine is tested every day, once plugged in and once unplugged. Make sure if you're running a user test to leave the machine plugged in and after a user test is successful. And then document successful user test and create in binder. In front of the machine, there are two cords that will connect to the patient. These are the Acg Leads, and these are for the paddles. Okay, before connecting them to your patient, make sure that these are secure. The LifePack uses these leads to connect to your patient. The leads are labeled where they should be placed if you're in a code situation. Here are your leads. You have the left arm, the left leg, and the right arm. You need also extra electrodes. They should be on the outside of the crush cart, and also on the outside of the crush cart are your pads. Here, the quick combo. Once you open the pads, they have a diagram to show you where to place them correctly, connecting to your patient. Okay, in order to connect the pads to the defibrillator, you will have to unplug the safety plug. If you forget, the machine will prompt you to do so. Now, if there's a case where you don't have the pads, you can use the paddles, but you have to connect the cord where the cords are currently plugged in. Okay, these are your paddles. Here you have the paddle for sternum and this one for the apex. In a code situation, we rely on supplies, so please don't remove any of these items, especially the pads from the crush cart, unless you are using the crush cart for your patient. Now let's go to defibrillation. Defibrillation, the communication is the key. If you are running the LifePack during a code, it is your responsibility to communicate with the entire team. What are you charging to? When you charge, make sure that the area is safe, stating I am clear, you are clear, everyone clear, oxygen clear, defibrillating and shock delivered. So with your monitor, you will go ahead and select the energy. Okay, let's turn on this button first, of course. And then select the energy. Here, there's an arrow for up and down here. Okay, you can choose which joules. Okay, here we are going to charge this just an example, like 250 joules. We are charged, so state I am clear, you are clear, everyone clear, oxygen clear. Okay, defibrillating and shock delivered. Okay, at this point, you're going to assess your rhythm, see if you have a pulse, and then if you need to continue the compression. So let's say there's a situation where we need to cancel the charge. I mentioned this already a while ago on the life pack. Okay, here the patient is you just imagine because I don't have the actual rhythm. Just imagine the patient is in VTAC. We are charging to 250 joules, and then we see our patient has converted. The patient have a pulse, so we are just going to press down the dial here, and this will cancel the charge. This way we don't accidentally shock our patient or shock any of the staff in the code. With cardioversion, our patient will have a pulse, so we're going to sync. Here's your sync button. We will press the sync button. This will track where there are R waves, so we don't shock the patient during ventricular repolarization. We will choose the energy, so go ahead and charge. So do your safety measures. I am clear, you are clear, everyone clear. Make sure patient have a pulse, check the blood pressure, and hopefully they have converted nicely. Another function of the life pack is that we can transcutaneously pace the patient with the pads that we have on them. The indication for transcutaneous pacing is when there is an abnormal slow in heart rate. It is used to correct profound bradycardia. Here, for example, our patient goes bradycardic. Just imagine, because I really don't have the actual rhythm. We will activate the baser mode here. We can choose our rate. So here we're going to say a rate of 80. You can choose here. There's an arrow. And we're going to increase our current until we see pacer spike and we see capture. So you should see a QRS complex following each of the pacer spikes. So we'll go up until you see a spike QRS pacer, spike QRS, and then go up another 10 milliamps. At this point, you wanted to make sure that you're checking patient's blood pressure. You are checking that they have pulse by checking the femoral or carotid artery. You are going to go ahead and prep them for catalog to get a transvenous pacemaker. Now, if you want to see the underlying rhythm, you can pause here the pacing, and this will turn off that pacer mode. And once you let the pause that the button go, it will continue to pace. So this is where you can see the underlying rhythm. Okay, another nice thing about the defibrillator is that you can mark key events on a code here button. So if you go into code situation, all you have to do is press the events button here, and then you just use the toggle here and press down to mark the times of the events. So when you start CPR, when you give epinephrine, when you are intubating, and then at the end of the code, you can press the summary code here. And on the left side of the machine, you can see the printer. You will print out a summary of the date and time and what event occurred. So that way you can match up with your documentation and to make sure that everything is accurate. Okay, this end of our topic. I hope that this lecture helped you to answer some of your questions on how to use the life pack machine. And by the way, I would like to take this opportunity to invite you. Please do visit my website and please do subscribe at naturalmedicine.com because I prepared an ebook for you and defibrillation. Just a screenshot of it. Just go to homepage and click Natural Meds PH. If you have anything to clarify, please do send a message. Just click the WhatsApp button and Messenger button for FB and my site. Or you can email me, Eileen at naturalmedicine.com. And also, please subscribe to my YouTube channel, Natural Meds KSA. Okay, that's all. And thank you very much for listening.